You get to the point where, okay, I'm diagnosed, I have it, now what? That patient usually goes to Dr. Metcalfe, and they would have what we call a CEA level, a carcinoembryonic antigen level. It's a blood test. And we do that level as a baseline because once we treat the patient, that level should go down. It's not specific for colorectal cancer because there are other things that can increase your CEA level, but most times if you have an elevated level, if you're treating it, you go down. It goes down. That serves as a baseline moving forward, whether or not the patient can have a recurrence. Once they get their CEA level, then they need to go for a CAT scan. The CAT scan shows whether or not it's spread to all those organs that we talked about. After they've had their CAT scan, they've had their CEA level, we know the results of the colonoscopy, they need to get clearance. And that's when they would go again to Dr. Metcalfe, their primary care surgeon, their primary care physician, to make sure that they're stable enough for surgery. So they get an EKG, they get a chest x-ray, they get their blood work done. So they make sure that they're hardy enough for surgery. And then they go to the hospital, and the hospital would do pre-admission testing, some of the same tests, and just check off the boxes to make sure that everything is done. And that's the point where the patient then goes home. They have to prep again for surgery. When you're looking at surgery, there are many options to do, depending upon what part of the colon is involved and if something is spread. Now, for patients who have had advanced disease, we generally treat them with chemotherapy. But if they do have advanced localized disease, we can usually sometimes do surgery as well as removing that isolated lobe of the liver. But the majority of times patients they go for surgery. I try to do my surgeries minimally invasive and laparoscopic because it's a shorter hospitalization stay, it's a quicker recovery, it's a better cosmetic result, and patients do well. They get out of the hospital sooner. There are some times where you have to have open surgery, which means you have an enlarged incision. So most hospitalization stays are usually about 3 days for a laparoscopic. They're out of bed, they're eating the same night of surgery, they're walking around. As long as their vital signs are stable, their labs are normal, they do well after surgery, they're home.